Okay, so in other videos we did some rotational things here on the table or bed. What we're going to do for this one is kind of put this into more of a functional context. So think of like if you're a runner or just generally have tight hip flexors, we want to have this sense of like trying to eccentrically control the hip flexors while still stabilizing at the core and not causing any kind of back pain if that's your issue, or just even if it's not, we don't want any. So I'm going to stabilize on the table here. I'm going to turn my body actually away from you here and at least a quarter turn so that I can catch more gravity when I'm coming back, but still keep a little bit of a twist. So again, I'm trying to rotate at my mid-thoracic or about a third of the way up, keeping my core engaged, thinking about like a running motion, and it's really more on the back as you follow through. And I'm going to, in this case, I'm going to anchor down to the table. So I'm going to pull here, keep this here, make sure that you're not going to like roll off the table and fall. So you got to really bear into it. Maybe start more on the side, on your side here. So I'm going to bring this back like so, just to where you can control, pulling that core, keep that engaged, and then slowly bring it back to about here. And then slow, let it down, slow, bring it up, and then slow, let it down. And then I can do that on the other side as well. The other one we're going to do is more for the piriformis, which is right on the upper buttock area. And that comes across like this. So if that's tight, painful, or if you have sciatica, that kind of issue, you're going to want to work that muscle. So I'm going to rotate kind of more through my leg, my hip. I'm going to turn my toes in as they come across. And then I'm going to come back and open up and kind of rotate externally. So it's this open close. I can have my knee more bent. That's how we collapse usually. So that's, when your knee buckles in, that's going to get in through there. But if I keep my leg straight, it's more leverage, and I can feel that pull right in through back here. That's a better one to kind of catch right there with some leverage. But if you can't coordinate or balance with that, you can certainly create some bend in the knee if you need to. And that'll get generally the hip flexors and the piriformis, both sides of the hip there. Good.